Have you noticed tiny white or yellow bumps inside your baby's mouth, maybe on their gums or tongue? It's natural to feel alarmed when you see these small, painful sores, and it's only human to wonder, is this serious? What can I do to help? These mouth ulcers are surprisingly common, about 1 in 10 children get them, and while they're usually harmless, they can be a real source of pain for your little one. Mouth ulcers in babies can be caused by a range of things, from accidental bites during teething to infections and vitamin deficiencies. They usually clear up on their own within a couple of weeks. But in the meantime, there are ways to manage their pain, avoid triggers, and recognize when it's time to see the doctor. Let's dive into everything you need to know, from causes and symptoms to the best ways to keep your child comfortable until those pesky sores disappear. What exactly are mouth ulcers? Think of a mouth ulcer like a tiny open wound inside your baby's mouth, painful, and sometimes even more so if it rubs against food or a pacifier. These sores are typically round or oval, and they can appear in different colors: white, yellow, red, or even gray. The most common spots are on the gums, tongue, lips, or the roof of the mouth. The pain can be consistent, even when your baby isn't eating. And if you've tried to breastfeed or bottle feed a baby with mouth ulcers, you might have noticed how sensitive they get, turning their head away or refusing to eat because it just hurts too much. Why do babies get mouth ulcers? There isn't a single reason for mouth ulcers in babies. They can happen due to accidental injuries. Babies love to explore, and they're just as likely to chomp down on a spoon, finger, or even their own cheek, causing a small injury. Teething. While teething doesn't directly cause ulcers, all the rubbing and biting can lead to tiny cuts, which can turn into ulcers. Infections. Certain viral infections, like hand, foot, and mouth disease or cold sores, can lead to painful blisters or ulcers in the mouth. Vitamin deficiencies. Babies who aren't getting enough vitamins B12, folic acid, or iron might be more prone to these sores. Recognizing the symptoms. If you've ever had a mouth ulcer yourself, you know they're no fun. The symptoms can vary, but here's what to look for. Painful sores in or around the mouth, especially when eating or drinking. Loss of appetite due to discomfort. Redness and swelling around the sore area. If the cause is viral, your baby might also have a fever or swollen glands. When should you worry? Most mouth ulcers in babies aren't a cause for panic, but certain symptoms should put you on alert. If your baby's mouth ulcers don't get better after 2 weeks, or if they seem to be getting worse, it's time to contact your doctor. Other signs that call for a doctor's visit include a fever over 100.4 degrees Fahrenheit, 38 degrees Celsius, swelling around the face, lips, or eyes, difficulty breathing, swallowing, or feeding, a large number of sores that keep spreading, any ulcers accompanied by vomiting, diarrhea, or other signs of illness. How are mouth ulcers diagnosed? Your child's doctor can usually diagnose mouth ulcers just by examining them, but if the cause isn't obvious, they might run a few tests. These might include swabbing the ulcer to test for viruses or doing a blood test to rule out any deficiencies or immune issues. The good news? If an underlying issue like a vitamin deficiency or a viral infection is found, treating that root cause can prevent future sores. How to help relieve the pain at home. You want to help your baby feel better as soon as possible. Here are some tried and true tips for managing mouth ulcers at home. 1. Cool comforts. Cold, damp washcloths can be soothing for babies to suck on, but keep an eye on them. Don't give hard, frozen items that might hurt them more. 2. Watch what they eat. If your baby is old enough for baby food, avoid anything spicy, salty, or acidic. Bland, soft foods are usually easier for them to manage. 3. Numbing agents. Ask your pediatrician about numbing gels that are safe for babies. Coconut oil or a dab of aloe vera can also be soothing. But always double check with your doctor first, especially for anything you put in your baby's mouth. 4. Stay hydrated. Even if they're not eating as much, encourage small, frequent sips of water to keep their mouth moist and reduce the chances of dehydration. 5. Keep nursing. If you're breastfeeding, continue to do so, as it can be soothing for your baby and help keep them hydrated. If the pain is persistent, talk with your pediatrician about over-the-counter options like acetaminophen, Tylenol, or ibuprofen, Advil, which can help relieve discomfort when medication is necessary. In severe cases, where ulcers don't seem to improve, doctors may prescribe a mild steroid paste or gel to help reduce pain and inflammation. But this is rare and usually reserved for ulcers that are either very large or don't respond to other treatments. Most babies with mouth ulcers won't need this, as their immune systems usually resolve the sores on their own. Are mouth ulcers contagious? This depends on what's causing the ulcers. Canker sores, for example, aren't contagious, so they're not a reason to keep your child home from daycare or school. But if the sores are caused by a viral infection, like hand, foot, and mouth disease or a cold sore, they can be contagious. In that case, it's best to keep your child home until the doctor clears them. Preventing future ulcers. Once your baby's mouth ulcers clear up, there are steps you can take to reduce the chances of them coming back. Here's a plan to keep your baby's mouth as healthy as possible. Good oral hygiene. Even before their first tooth comes in, gently clean your baby's gums with a soft, damp cloth after feedings. This keeps their mouth clean and reduces the chance of infections that might lead to ulcers. Balanced diet. As your baby begins to eat solid foods, make sure their diet includes enough fruits, vegetables, and proteins to provide essential vitamins and minerals. Manage underlying conditions. If your child has an underlying condition like vitamin deficiency or frequent viral infections, work with your pediatrician on a plan to manage these issues and minimize mouth ulcer risk. Final thoughts: when to call the doctor. While most mouth ulcers are mild, keep an eye on them. If they persist for more than 2 weeks, spread, or are paired with other symptoms like fever or dehydration, reach out to your pediatrician. They can help identify and treat any underlying causes, ensuring your child's comfort and health. Remember, you're not alone. Mouth ulcers in babies are common and often clear up on their own. With a little knowledge, some patience, and the right approach, you can help your baby stay comfortable and smiling through the healing process.